Hello everyone, welcome to Family Dental Clinic. I am Dr. Ashish Sharma. We are really overjoyed by the response, the questions being asked and the viewership by you all for our videos. It is making us feel so happy. Thank you so much for the love. Now today we are going to talk whether you should go for a crown or a veneers. When you visit a dental clinic, there are options which are given for veneers also. So today I am going to tell you that what are veneers, what are crowns, what is the difference between them, and which is the most suitable in your case, and how do you get it done, what is the time duration. So the first thing is that we should be very sure that what is the difference between a veneer and a crown. So I would like to show you this patient's cast. This is the cast of the patient, in which, can you zoom a bit, in which there are two veneers in the front teeth. These two are veneers and these two are crowns. So this is a crown which is covered fully. In this case, we trim the whole tooth and we give a crown. And in this case, we don't trim the whole tooth. You can see that the back side is empty and it is the tooth surface which is there. You can see here. So this is the basic difference between a veneer and a crown. So these veneers and crowns, they are basically made of porcelain. The question arises that do they get stained? So the answer is no, they don't get stained. Obviously, if you are having some tobaccos, then they will get stained. That natural teeth also get stained, but not in this case. The durability of veneers and crowns. See, no dentist is going to tell you, or maybe at least I don't tell that कि आपका veneer 10, 20, 50 साल, 30 साल चलेगा. It's not like that, but it lasts very long. 10 years, 20 years, 15 years. It goes good if you go for a good quality veneers. Now, when do you give a veneer and when do you give a crown? So veneers basically, especially when you take up this case, the patient wanted to go for a complete change of color of his teeth. So we told him that you can go for veneers for these two. He got a root canal done for these two teeth. That's why we gave him crowns. So when there is a root canal done, that time also we can give veneers, but we have to see that how much tooth structure is left. That is also another important aspect. So veneers basically we give when the patient wants to change the color of his teeth, mild gapping is between their teeth, slight rotation, the shape of the teeth is not good, then we go for veneers. But if we want that the patient needs a crown when the structure is a bit destructed and we need to cover the entire teeth, when we need to protect the entire teeth, in that case we recommend the patient to go for crowns. These are crowns. Again, I am showing you these are crowns. So the process is very simple. Now coming to the process of veneers and crowns, as I have told you that veneers are not full covered. Veneers are from the inside part, it is like this, that is your natural teeth will be there. Just outside and very less teeth structure is removed when it comes to veneers. But when it comes to crown, all the aspect of the tooth are covered, are removed, a bit trimmed off so that a crown can fit into it. Now the process duration for the veneers, many people they are coming to us from outside our city. So they want to know that how much time it is going to take. So for veneers and crowns, we basically do that, we start the case the same day and take the measurement for the veneers or crowns and give temporization on the same day itself. That is chair side only we give the temporization. The patient can go back within the same day and then come after a week or so when the final preparation, that is the final crown and or veneers are ready. So this is the way we do it. How do we know that which shade is going to match? So there is a shade guard which we use to select, to see what shade is going to match for the veneer or the crown. So this is all I can tell you in brief about veneers and crowns. These are very good looking crowns and veneers which are made nowadays. They look so natural that nobody can identify, nobody can differentiate whether it is your natural teeth or it is an artificial teeth. Thank you so much. Do visit Family Dental Clinic if you have any other such queries. Thank you.